Hello again, social value in procurement. Social value in procurement is our third panel of the day. In 2020, the NHS announced an ambition to become the first net zero healthcare system in the world, with the aim of meeting this commitment by 2045. Currently, 60% of carbon emissions produced by the NHS occur in the supply chain. The implemented plans in social values are predicted to improve conservation efforts as well as provide better value goods and services for NHS trusts. As the emphasis on net zero is crucial, support processes for mental and physical health in patients and NH staff is paramount as well to make the new procurement process succeed. So let's meet our guests for this discussion. We have with us Siarah Meah, Social Value Manager, NHS London Procurement Partnership. We may get Heather Benjamin, Non-Executive Director, Supply Chain. We're just trying technically to get her systems to work, so she may just pop up. And we already have Alexandra Hammond, Head of Sustainable Procurement and Supply Chain at NHS England. So do please keep using the Q&A feature so that we can pass your questions on to our panellists. Anybody that's been on this platform before knows that I always like to try and make it a conversation. And when you submit questions to our panellists, then that definitely makes it a conversation rather than me just asking all questions. And I'm just going to click my live Q&A function there so I can see them coming in. Good morning, ladies. How are you?
Great, thanks.
Good, good. Shall we just start off with you, Siarah, just sort of hearing a little bit about what you do and your role at NHS LPP?
Yes, certainly. Thank you very much, Helen. And good morning, everyone. My name is Siarah Meah, and I am the Social Value Manager at NHS London Procurement Partnership, or NHS LPP. I'm very happy to admit I'm very new to the NHS, so I'm about 6 months into my role, but I'm not new to social value. My previous roles have involved working with London local authorities to implement social value strategies there. And prior to that, I worked at an organisation called the Social Value Portal, and that is the reporting and monitoring tool that has recently been procured by NHS LPP as we implement the social value requirement and tender processes. So my role here is to really support the rollout of that tool amongst the 44 London trusts and work with them to implement social value requirements with a view to monitoring the delivery of those during contract management. Thank you very much.
Oh, and just before we hear an introduction from Alexandra, Siarah, how are you enjoying the move to the NHS if you're just 6 months in?
I am absolutely loving it. I've been delightfully surprised by the enthusiasm around social value and how high it is on the agenda for the NHS, which is brilliant to see. In my previous roles, I've been quite used to people not being familiar with social value, but actually I've been how much the NHS already know and what they want to do, and now it's just about educating the supply chain, what our approach is and how we can work together to achieve that. And it's also been lovely to be able to engage with suppliers because once they understand our approach and have received training and support from us, I think there's a big misconception that social value might act as a barrier for suppliers, but actually what we've seen is if they have the right support in place to, and we can remove any blockers in that bidding process for them, actually suppliers are more than happy to be able to showcase what it is that they'd like to, that they're able to offer as value for local communities. So it's been fantastic to see, and the NHS as being an anchor institution can have such a huge impact by implementing these social value requirements. So in months to come, it will be very exciting to see the type of insights that we learn as contracts move into contract management stage and we start to see data being delivered. So it's been brilliant so far. Yeah.
Oh, that's really nice to hear. Heather, I'll come to you in a moment, Heather. We're just doing a little introduction. Alexandra's just about to introduce herself and tell us what she does at NHS England.
Thanks, Helen. So nice to be here today. I'm Alexandra Hammond, and I lead the Sustainable Procurement and Supply Chain team at NHS England. So my team is responsible for the decarbonisation and implementation of social value within the supply chain of the NHS. No small task, I should say. But we are really a team that shapes policy and supports our NHS England, but also our wider NHS colleagues across all of England to implement sustainable procurement in any way. So we, as a team, have implemented the social value model that Siarah was speaking about just a moment ago. So that's something that's in every single one of our procurements, the minimum 10% weighting on net zero and social value. But also we are asking our suppliers to decarbonize their operations and eventually decarbonize as well their Scope 3 emissions as well. So we're really partnering with our supply chain to really make this program implement in a meaningful way.
Oh, I'm looking forward to hearing a bit more in more detail later. As you say, no mean feat decarbonising the NHS. Heather, I'm so glad that the gremlins in your system have allowed you to join us. Welcome. We just thought we'd do a little introduction to everybody to find out what they do and about their roles. So will you pick up and just tell us a bit about yourself and what you do, Heather? I don't think we've got sound on, Heather. I don't have sound. Let's try again. Try again, Heather. Let's just see if we've got your sound now. No, I don't know. Perhaps I'm not sure whether there's sound on the platform, but we might have to. Let's move on to Siarah, and perhaps we can try and sort the sound out, because I'm certainly not hearing you, Heather, and I would imagine that if I'm not hearing you, then perhaps other people aren't either. Siarah, can we turn to you now? Oh, Heather, are you there?
Yes.
Oh, there you are, Heather. Yeah, so just a little introduction about your role and what you do, if that's okay.
Sure. Yes. I'm sorry about that. The gremlins definitely were there. So yes, I'm a non-executive board member for Supply Chain Coordination Limited, and I'm the lead NED for the sustainability across the SCCL, and of course that means across the NHS as well, because we are very much one NHS, and how we are working together to support the supply chain. So I'm also on other boards as well, where sustainability is one of my key passions. So I put my hand up whenever any of that time that topic is taken, and I can then share lessons across different boards. So where I fit in.
That's fantastic to hear. We'll hear a little bit more about that in a moment. Siarah, let's go back to you and let's start with the very basics. What is social value and what does it mean to NHS LPP?
Fantastic question, thank you, Helen. So some of you might already be familiar with definitions of social value, because there are lots of different definitions of social value that have been adopted by organisations, but I think the commonality between them all is the element of additionality or added value in areas such as the environment, society, and local economy. So to NHS LPP, social value is defined as being about securing maximum impact or securing added value against local priorities from public procurement. So this approach will allow trusts and the wider public to benefit from a social return on investment from the public purse as a result of suppliers carrying out different social value interventions. So it's all about the direct and indirect impacts and outcomes that can be achieved through engaging with a whole host of environmental and socioeconomic measures that have been designed to create positive impacts for communities.
You're right that there are lots of different definitions, and it's nice to set the scene actually at the beginning as to what we're talking about here. Alexander, how is NHS England supporting the wider NHS to try and get more social value out of procurement? Because it really is important, isn't it? And at the end of the day, it's people who benefit when you get more social value out of the procurement process.
Yeah, absolutely. One of the key things that we did, and this was from April 2022, is we adopted the procurement policy note, the social value model that has been developed by central government. So the NHS wasn't in scope of that originally, but we decided to ensure that all of our procurements included a minimum weighting of 10%. On what we call net zero and social value. As you mentioned at the beginning in your introduction, we have a very, very ambitious and clear target around our delivery of net zero. So we really draw that out in terms of emphasis with our colleagues to make sure that we're capitalizing on opportunities to deliver lower carbon services and products wherever we possibly can. That doesn't mean that the other themes within the social value model are not equally as important. They are very, very important, and we encourage them too. But we really, really ensure that every procurement includes social net zero. In terms of how we're supporting, there's really no end to the amount of things that we're doing. I'll keep it relatively succinct. So we've created some guidance that supplements the Cabinet Office guidance on the social value model that really kind of draws out NHS specific priorities and helps those working in procurement and commercial to take good questions, make them meaningful, make them relevant. Really emphasizes the point Siarah made about additionality, that this is something that needs to be delivered as part of the contract that they wouldn't otherwise be delivering. And also to really help them make sure that the questions that they're asking result in measurable commitments from the suppliers. So we have a sort of end-to-end process where we support our colleagues to make sure that these are included in the contract and that they're clearly set out. So those measurable KPIs are set out in the contract so that they can be monitored and that they can be, that their implementation is ensured through accountability. We have within my team, we do a lot of bespoke support on particular procurements. So colleagues at NHS England or within the NHS will get in touch with us and say, hey, I've got a really big professional services contract that I need to be procuring, and I really need some support with getting the right question in there. And so my team supports with that support, and also it's sometimes with the evaluation, though we have a relatively small team, so there's some limit to that resource. So what we've done to support that ongoing development and training and upskilling of our colleagues on net zero and social value is we've developed a 3 e-module trainings on net zero and social value and how they specifically apply to the NHS. And they're really engaging, they're really interactive. They'll be launched actually this month, either this month or the early in October. And it's hopefully a really good resource for our colleagues. But what we've learned about the delivery of social value is it's not a tick box. It's not a yes, no. It's not a binary question that you can sort of sort out at the very beginning of a procurement and then let go. You really need to keep the conversation going, continue to make it meaningful and relevant to the kinds of contracts that are being tendered. So it's a significant amount of support and resource that's required, but we are providing quite a lot to our colleagues.
Fantastic. Just briefly, because I want to obviously bring Heather in, but Alan asks, Alexandra, is anyone in England using TOMS to measure social value delivered?
Yeah, I mean, many people use the TOMS. I mean, the Social Value Portal recently released a new set of these are metrics that people can use to help deliver some measurable social value out of from different activities. We as NHS England are creating quite specific and bespoke guidance on the different types of things that we buy, and support, rather than saying use the TOMS. It's a very big and very broad tool, and it's fantastic, but it doesn't necessarily help when it's sort of like being given the ocean. You need to sort of be given the things that are the bay that you need to go into on your particular procurement. So we're supporting our colleagues with net zero and social value category strategy support to make sure that they're including the right metrics in there, and we certainly use the TOMS as a resource as well.
Heather, in your introduction, you mentioned that you sit on other boards, and I'm just wondering, you alluded to using that board learning, from different sectors. I'm just wondering how you use that learning with different sectors to help shape the supply chain coordination journey for social value in procurement.
Yes, thanks very much, because that is probably one of the key areas where a non-exec member can actually tap into not only on what's happening in other boards, but they've got great networks where we sit and talk about really live issues that are happening strategically with other chairs and other NEDs, and everyone is on different journeys. And also, depending on what kind of headwinds are actually happening in those boards, they have competing. So making sure sustainability becomes an integral part of the strategy is really key. One of the hardest parts, I think, is the start. And it was talking about Alexandra about which bay do you go into. Getting the data and the starting point is really important. And then reminding people that the years are really ticking off very quickly. So you can't spend ages getting absolutely everything perfect. You've got to start driving some of these initiatives very, very quickly at different speeds. But you've got to think through the end game and not set KPIs that are very easy at the beginning, because otherwise you're going to run out of room by the time that you get to where it is that we're actually getting to. So, but I think this is where it's been really great working with the supply chain partners, because they've got wonderful things actually happening in their particular strategies as well. And it's making sure we're actually talking to each other. That innovation, and just sitting and waiting for ideas to come up, because and it's tender stage, we're actually doing that right through the period that we're working with them. So so it's actually capturing that, and then when I move into any other boards, I can not only say where are we on the journey now, but where do you have to get to, and that we work very closely with NH England to see what is happening elsewhere, and making sure that we can be ahead of the curve.
You're so right. It is about taking that first step. I've seen it in other industries. That first step can be paralyzing, but it has to be taken, because those ambitions, those years that we look forward to, that, you know, will be net zero by this point, it's rattling by, and it'll all come much quicker than I think we realize. So it's good to hear you say that. Siarah, why is social value, do you think, the answer, and the approach certainly that NHS LPP have taken?
That's a very, very big question. I guess before I go on to answer your question directly, I think I'd just like to touch on Alan's question, because at LPP we actually are using a kind of hybrid approach of the social value model, but also the TOMs. So we do have a list of TOMs that we have developed using you know, the social value portal released multiple lists or frameworks of social value TOMs, which stands for themes, outcomes and measures. And we have selected the measures that speak most to the NHS and London priorities to create our NHS London TOMs. So I always get very excited whenever the TOMs get mentioned, because that's my area of expertise. Obviously, having worked at the social value portal prior to joining NHS LPP, I was able to gain so many insights from them and work with them to better understand the TOMs and its implementation. So just wanted to drop that in there quickly, because yeah, I'm a big supporter of the TOMs, and also, you know, completely understand the comment around it kind of presenting the ocean and where do you start. And we've been asking ourselves the same question, and to try and make sure that the support that suppliers can offer is targeted. We've been developing lots of resources and guidance, working with ICSs to create business directory. So it will be a list of local VCSEs and organisations that suppliers can work with to deliver social value in line with the measures in our framework. And our framework currently is around 40 or so measures. And what that does is it gives suppliers the freedom of choice to select the measures that are feasible for them to deliver, but also means that regardless of which of those 40 or so measures you select to commit to, you will be affecting a priority area for the NHS and London. So just wanted to drop that in there. But I mean, to answer your question, why social value, why is that the answer and the approach that we've adopted? Well, firstly, to begin with, the procurement policy note and the NHSE guidance, which mandated its implementation, but also prior to the PPNO 620 and guidance from NHS England, social value has already existed. So local authorities have been including social value in their procurement processes for a number of years now, since the release of the Public Services or Social Value Act which was released in 2012, and that's meant at a local level, social value has already proven that it as a concept works and has proven to deliver millions of pounds worth of positive impacts and benefits for local authorities. So I feel as though the NHS are really playing catch up with that to jump on this wave and be able to maximise the outcomes that we can have through the procurement process, as local authorities have been doing for a number of years. But also, I think it's the answer because social value reaches so many challenging areas that we as an anchor institution are working to tackle. So it isn't just the environment or jobs and employment, it is everything. It is focusing on volunteering, but also reducing carbon emissions, but also employment opportunities, upskilling opportunities, spending with small local organisations. So there are a whole host of different impacts that we've had through applying the social value framework that we've adopted. And also, the social value approach that we've adopted doesn't just unlock benefits for communities and allow us to make big impact through small changes, but also encourages a really collaborative approach between the NHS and its supply chain and the local community. So we're working at an ICS level to understand the challenges that are faced within their local communities and developing, as I mentioned, those directories so that suppliers can engage with specific stakeholders to deliver social value in the areas and for the people and organisations where it is needed most. So, for example, VCSEs, which are in need of support, can be connected to suppliers so they can target the social value initiatives and interventions in a way that is providing support for where it's needed and for those it's needed for the most.
It's my Q&A panel has completely lit up. So I think before I carry on with the sort of plan of where I was going next with you, Alexandra, on sustainability and exploring that particular area, can we just whip through a few quick questions from the audience so that we make sure we get them in? Perhaps, Alexandra, you could answer Jane's query. Is social value training available for providers?
Yeah, there's quite a lot available from central government. So the answer is yes. It's not something that we, well, by providers, do we, I suppose what the, if by providers you mean the providers of services to the NHS, meaning their suppliers and commissioned services, then the answer is we don't provide that specifically. However, because what we're really trying to do is make sure that our colleagues within NHS and procurement are asking the right questions and making it relatively simple and straightforward for our suppliers to respond to. I always really struggle when I see a tender where it has 12 social value questions, you know, and each is worth less than 1% of the total value of the score. And I think what we need to be doing is asking good, relevant, additional questions that are really going to drive some sort of change. And what Siarah mentioned earlier about how we, this is an opportunity for us to partner with our suppliers. So if by providers you mean providers of NHS services themselves, then yes, there is training available, and that'll be available to really everyone in the NHS. The training I mentioned earlier, right, from on social value units here.
Lovely. Heather, I don't know whether this is whether you're the right person to ask this question to, but we'll try, and if not, maybe Siarah might have an answer. George is asking, is there a centralised place where NHS organisations can share success stories and lessons learned from implementing social values / sustainability measures into our procurements?
I don't know if there's a centralized place, but certainly the stories are actually what really brings things to life. So any opportunity that we can get to actually share some really great things that are happening and to have the data to actually reinforce what it is, where it's adding value, either in the community, reducing carbon emissions, we take every single opportunity to get those shared. I don't know Alexandra if there is a central place where that actually happens, but it brings it to life. So it's absolutely key that you grab the lessons learned from everybody.
So right, Alexandra, just briefly, because we've got quite a lot of questions coming.
Yeah, I couldn't agree more. It does. So we have something called Future NHS Hub, and there's lots of different forums within that for NHS members of staff, and we have a social value sort of conversation that happens in there where we share lots of things. So yes, there is a central place. I can put the link in the if I can post in the chat, I'll put it in.
And Leanne is asking, Siarah, perhaps one you can answer. She says that for third-party suppliers who partner with primary managed service providers in the large network tenders, will the requirement/contribution be proportionate to the third-party contract value? As a significant third party, we seem to get cascaded all of the social value requirements in a tender, and they don't always seem to be proportionate. Is that something perhaps you can tackle, Siarah?
Yes, absolutely, and it's a brilliant question. It's one that I've been asked by suppliers who are bidding on contracts. We've received clarification questions over that in the past. Again, just before I jump onto that question, just to go back a step around the support that's available for providers and suppliers. NHS LPP do actually host monthly drop-in sessions for open to all suppliers. Whether you're already delivering work for the NHS or you are just wanting to understand how you can work with the NHS. And those sessions are to help suppliers understand what our approach is to social value, what that process looks like through the actual social value monitoring and reporting tool, and how we can work together to achieve and unlock benefits for communities and what our priorities are. So I again just wanted to drop that in there. So the framework that we've adopted, the measures in our framework have got specific requirements. Those measures do extend down to third party and supply chain partners, and some don't. And the reason why some don't is so that tier one main contractors do not just kind of pass down all of their social value requirements through the supply chain and not actually be responsible for any of that themselves. So one important thing around social value is the element of proportionality and only claiming for what you are directly responsible for delivering. Some of the measures, however, are for supply chains to be able to deliver, and that can contribute and feed into the wider social value amount that the tier one supplier is claiming for, but not all of them. And again, the reason for that is to prevent this case of oftentimes smaller organizations within the supply chain who are then loaded with social value obligations that really should be delivered by those main tier one contractors. So that's something that is included in those bidder engagement drop-in sessions that we have, is reviewing the measures that are included in our TOMS framework and making it clear. There is guidance available on the portal that we've procured that bidders will use to submit their social value offers, which explain to them which measures can be sort of carried out through the supply chain and which measures are for that main tier one contractor. And then obviously during the evaluation process, that's the procurement team's opportunity to kind of weed out any commitments that might be entered incorrectly or entered on behalf of the supply chain, when really it should be the responsibility of the main tier one contractor.
That was a very good answer. Thank you, Siarah. I knew that time was going to fly on this panel. Martin's asking, will this session be available online after it's complete? Yes, Martin, you will be able to watch it back. So that's good. So let's just spend the last couple of minutes, Heather and Alexander. Heather, how are you aligned with the wider net zero program within the NHS? And then I'd like to end on Alexander talking about your plans in the coming years. I know we haven't given many more minutes to it. We've skated across sustainability and it's so important. But Heather, will you give us a sense of how you're aligned with it, where you are?
Yep. Yeah, well, it's certainly absolutely part of our strategy. It is not an add-on, and I think that's one of the most important parts of it. And we look at particularly 4 key areas: human rights and labour standards, and the work that's been done to look through transparency down the supply chain, particularly with the resilience issues that we've had to deal, the geopolitical side of it, is absolutely key to make sure that the supply chain is resilient. And that transparency, I think, has phenomenally changed over the last 2 to 3 years, and this is part of it. The waste and the circular economy, that's an area that is growing. Just trying to understand where is it that we can actually make sure that we reduce any waste. Done a huge amount on plastic products and packaging, and a lot of suppliers are doing work with respect to that. And then obviously the climate change, energy, the green gas side of it as well, we've talked a lot about, but that is part of the way that we're operating. But picking up one point about employees, if we do not do this, we will not attract and retain our employees. And they have fantastic ideas about what is it that we can do. And when they're talking with their suppliers, you know, they are looking to see, is this someone we want to work with? So I find that they are very much the front end to actually making sure we keep them, because they know that it is a significant part of the way that we want to operate. So, so culturally, that's really key.
Alexandra, I'm going to give you the last word, and sorry to squeeze you on it, but I don't want to eat into our keynote speaker. It's a whole panel on itself, isn't it? But you know, your plans for net zero and social value over the coming years.
Fantastic. I'll also put this in the chat. So we have a very clear plan. It was approved by the NHS board last September. It's called the Net Zero Supplier Roadmap. And it's got a number of milestones between now and 2030 as to how we want suppliers to work with us and how we want to work with them. We also have, we'll be shortly launching a supplier maturity matrix called Evergreen that will allow suppliers to tell us how they're doing against the supplier roadmap, and get credit for it in their procurements. And so that's something that we're really excited about. I mean, we have big ambitions. At the moment, we're asking suppliers to start their journeys. You know, it's not too onerous. We'll be asking for them to have carbon reduction plans for the scope 1 and 2 emissions. But we really need suppliers to start thinking about their suppliers' emissions, so their scope 3 emissions and down their supply chain. That's really how we're going to start to make meaningful change. And so that is a big ambition of ours, and it's from 2027 in the roadmap. So I'm just putting a link into.
I think we've lost. Oh, we lost the sound there, Heather. You're putting a link in for us.
Yes, yeah, links in the chat.
Heather, Alexandra, links in the chat. That's fantastic, and thank you for doing a very succinct answer there. It feels like we need a whole panel discussion with the three of you. So much interesting learning there. You've all been absolutely brilliant. So a massive thank you to our panelists there, to Siarah, to Heather, and Alexandra for sharing their knowledge and time with us. Gosh, that half hour really did whiz by. Next up, though, we have our second keynote speaker, Alison Brett, Managing Director, NHS Commercial Solutions. Having worked as a procurement professional in the NHS for 41 years, 23 of them within collaborative working environments, Alison is firmly convinced about procurement's key role in the delivery of quality improvements, as well as in the achievement of value for money. Alison has a strong commitment to building and developing strategic partnerships designed to improve patient care. So let's welcome Alison to the virtual stage.
As Helen has just said, I'm Alison Brett. I'm Managing Director of NHS Commercial Solutions, and we're an NHS collaborative procurement organisation based in Dorking in Surrey. Next slide, please. So just to put my organisation into context, we're an NHS collaborative procurement hub that provides end-to-end services across the full procurement cycle. We work to unlock collaborative solutions across the NHS and wider public sector, supporting acute mental health, community, ambulance trusts and commissioning organisations. Since we formed in 2007, we've saved our customers more than £250 million. And as you'd expect, as collaboration is in our DNA, we also deliver services together with our NHS Collaborative Hub colleagues as procurement in partnership, which gives us national coverage across the NHS. We're fully owned by the NHS and funded and are hosted by Surrey and Borders Partnership NHS Foundation Trust. And we also operate an integrated procurement service, which looks after 2 local mental health procurement teams, Surrey and Borders Partnership NHS Foundation Trust and Sussex Partnership NHS Foundation Trust. Next slide, please. So my reflections, when I was asked to do this session, the brief to me was to reflect on my experience, which as you now know is quite lengthy. So in corporate memory terms, I do have some of the pieces of the jigsaw. That is the evolution, really, of NHS procurement over the last 40 or so years. The theme of this conference touches on many aspects of procurement, data, information and transparency and supplier engagement. And there have been so many changes and developments in technology and systems over the time I've worked in the NHS. It's incredible. And we could say that digitalisation now offers a revolutionary opportunity for healthcare and procurement for the future. I am a reflector by nature and a believer in learning from the past. So this definition caught my eye. And to have in mind as we go to the next stage of transformation in the NHS, that we should be having some mindful considerations and an analysis of past thoughts and actions. I think this is really important, and to have this headspace and to think about our observations and our own experiences for the future. Again, let's not lose our corporate memory. It really does have a place. So looking back to my early career in the 1980s, I worked even then in some really forward-looking organisations, embracing a divisional footprint, which ironically is very similar to an ICS footprint nowadays. And you will have heard from previous speakers about ICS development. And also those management structures were very similar in the mid-80s. Logistics and procurement were an integral part of the system and very well connected to the management team. Then in the 1990s, logistics developed apace, and it was an era for procurement in the NHS as a customer services function at both regional and local level. And perhaps that wasn't the best decision for the procurement profession, but we also had a focus on regional contracting. Then in the early 2000s, we saw a national focus emerge, particularly after a Cabinet Office report and the formation of PASA, the Purchasing and Supply Agency. That actually offered leadership and expertise in contracting, advisory and policy making. And regional supplies confederations then emerged, mirroring the NHS structures of regional health authorities and the emergence of Foundation Trust. Next slide, please. So the transformation journey for NHS procurement has really seen some very key milestones. And some of the milestones that have emerged in recent years, I think particularly anchored around the period 2007 to 2010, which really formed the current infrastructure and landscape in the NHS procurement world. The establishment of NHS supply chain and regional collaborative procurement hubs were in those early years of the 2000s, 2007 to 2010. And very sadly, in my opinion, the dissolution of the Purchasing and Supply Agency also occurred during this period. It had done some great work and provided fantastic leadership to the procurement community, as well as opportunity. In the intervening years, we've seen some very key conversations developing and a drive towards tackling unwarranted variation. Some key reports, such as the Carter Report. And between 2017 and 2019, I think we've entered the pre-COVID era, where we saw the Procurement Target Operating Model transformation project emerge and the establishment of the new supply chain model and category tower development. And then the rest of the focus on the procurement landscape. And really that was a time of pivotal change in direction for NHS procurement. But of course, as we all know, in 2020, we were hit by the seismic wave that was COVID, the climate change crisis, the impact of Brexit and post-COVID inflationary pressures, and a major reform in the form of ICS establishment. So I think that takes us up to the present and looking into the future. As you will have heard from David earlier, the establishment of the central commercial function marks a really significant change, with very welcome leadership, new systems, a national e-commercial system rollout, national programs across sustainability, as we've just heard from speakers, and innovation, capability development, the supplier relationship management agenda, and establishing buying pathways, many and very welcome initiatives. So the NHS is going through a period of incredible challenge and transformation as we wrestle with the ongoing effects of the pandemic. We have supply chain vulnerabilities and the real need for supply chain resilience while facing rising costs at the same time as tackling the sustainability agenda with its demanding and critical targets. Those major structural changes that are underway in the NHS, as you will have heard, establishing 42 integrated care systems across the NHS, is a really significant change and reform for all organisations. And the procurement bill replacing EU directives and the adoption of new end-to-end e-enablement systems gives us the opportunity, I think, for more complete commercial transparency and the visibility of procurement spend and opportunity across the system. Although adding another level of complexity for NHS procurers, I think it's extremely critical that we have this to have effective national commercial strategies. Next slide, please. So it's been another busy year, and I think these headlines speak for themselves. So post-COVID recovery, elective recovery, and heading towards winter pressures are very much in the minds of all of us across the NHS and particularly in procurement. Next slide, please. So looking at this from a local and a regional procurement perspective, the agenda and the to-do list is very long and far-reaching. And I think these are only some of the key areas, aside from a longer list. And there are many other social, political, and economic factors to deal with. In addition, I think, as we all know in the procurement community, capability and capacity for procurement teams remains a really significant issue. However, with challenge comes opportunity in how we tackle this agenda and transform as NHS procurement. So I think as we're facing another level of challenge post-COVID, you might say this is the era of collaboration. As one of my team said to me, isn't it great that collaboration is back in fashion? I truly hope it is. Also key in our transformation is the digital agenda and learning from COVID and our ability to virtualize, use technology and adopt different working practices was really tested during this time. It has so many applications in how healthcare is delivered and how we can develop in procurement. Next slide, please. So I rather like this quote when thinking about what are the critical success factors for transformation. We haven't come this far to only come this far. So we do work in an ever-evolving and changing NHS. And from my organisation's perspective, we saw the need to review and quite fundamentally change the way we work as a real requirement to be fit to operate in the future. And so from our own transformation programme, I just picked up a number of key issues where we work both internally within the organisation and externally, and have just spotlighted some of those activities as perhaps helpful to everyone considering their transformation journey. We looked closely at proactivity, transparency, our reliability, our accessibility, how involved we were with all of our members and the wider NHS, and our agility and ability to react quickly and accelerate change. And I think underpinning all of this is a key theme for us in the transformation journey for the NHS and NHS procurement and to deliver more. And in these demanding times, I think collaboration, cooperation and partnership working is absolutely key. Next slide, please. So we've always taken a partnership approach, and this is a bit of a snapshot of some of our partnerships. As you can see, they're quite wide-ranging and often a solution to the many changes in the landscape since our establishment, and the challenges that we have faced have been to adopt and develop partnerships and to look at services that we can offer across the NHS beyond our local membership. I like to think that we think local but act global. We've always collaborated, but I think we are seeing a step change in how we deal with challenges for the future, and recognising the benefits of closer working, embracing new technology and not duplicating activity is very core, keeping close to our core purpose to deliver value for the patient. So I'd just like to spend a moment looking at how we in NHS Commercial Solutions collaborate with our NHS Hub partners. Next slide, please. So as you can see from this slide, we have a collaboration called Procurement in Partnership with our 3 partner colleagues in NHS collaborative organisations. Next slide, please. And our influence and impact is primarily in the non-medical agenda for NHS procurement. And here are just some facts and figures, if you like, about some of our achievements and some of our current reach. So our procurement teams are recognised as category experts in our fields, in workforce, clinical, digital estates, pharmacy, professional services, and the ambulance services. We've got some proven national reach. In fact, 96% of the NHS uses some of our frameworks in one form or another. We've also formed a very key alliance with CCS, with Crown Commercial Services, to deal with the temporary staffing and workforce issues, which are a huge challenge to us in the NHS, called the Workforce Alliance. And we're also delivery partners together with NHS England and the CCF team in terms of developing ICS procurement. We've also delivered some key pieces of work and programmes, such as digital, the electronic patient record, and end user devices. So our primary focus is about doing the right things well, minimising duplication, and we cover over £3 billion worth of spend and have delivered over £235 million worth of savings. So collaboration is at the heart of what we do in PIP, and it manifests itself in a number of ways for us. The way we work with our members and customers to provide solutions and develop solutions for their needs, collaborating with other NHS and public sector bodies. And I think we bring a unique value as we're grounded in doing the right thing for the NHS, and every pound of what we deliver goes back to the NHS in terms of any surpluses. And we often give this back to our members in the form of rebates and dividends or investment in other pieces of work. And it's very interesting and timely, I think, that the Department of Health recently produced a report called Health and Social Care Review for a Collaborative and Inclusive Future. And it's focuses on strengthening leadership and management across health. And there are recommendations about raising the capability of leadership and management and collaboration in the health system. Next slide, please. So my final thoughts, if you like, in terms of key themes for procurement, and collaboration is clearly one of those for me, and it's a key enabler. But I think there's almost a golden triangle of activity for us in procurement in terms of our focus. And that's linking the sustainability, transparency, and digitalisation agenda. Without increasing transparency, I think our commercial impact as procurers is always going to be limited. And as health is a major contributor to the economy, but also a huge cost, I think it isn't just about price. Not to minimise this and the drive for savings, of course, but comparing, working together, benchmarking approaches to supplier and market management, our tools and techniques, our category strategies and market intelligence, and being transparent about this is going to deliver higher value, higher quality to the NHS at such a critical time. I really welcome the strategic supplier management approach from the central commercial function. I think that's where innovation starts and can be shared across the NHS, going beyond benchmarking the price of a product. I think it's very interesting that we're seen as leaders in the adoption of sustainability too across Europe. And this has been addressed at a national central level by the NHS Greener Team and Sustainable Development Unit. And that central focus is really welcome. So sustainability and social value, I think, is woven in and can support and deliver all the value that we want to deliver as NHS procurement professionals from procured products and services. And I think it's relevant to everything we do. All good services and works require that approach, either in contract outcomes or how suppliers manage their own business practices. I think all of this is linked to the opportunities of the digital agenda and transparency to enable more collaboration. It's literally an ecosystem which we can use as procurers and delivers us broader and many more exciting opportunities for our profession. So finally, is this a blueprint for the future? We are facing many challenges, some of them unique to the NHS, and I think some of them are prevalent across the entire public sector. The answers to these, I think, lie within the many NHS organisations I'm sure in the audience today, and also across the entire NHS supply chain. If COVID has taught us anything, it's that we do have incredible resilience and the ability to overcome any obstacle or barrier in our path. In recent years, we've seen countless examples of pioneering approaches and new solutions, both in terms of procurement practice, but also through the ingenuity and creativity of our procurement teams and the suppliers they partner with. We've achieved things that pre-pandemic would have seemed impossible previously. Adversity really is a powerful driver of progress. Our new challenges include not just the immediate recovery from the pandemic, but also how we can ensure the NHS continues to provide outstanding services for patients across the UK. It's an agenda that covers not just healthcare, but so many other critical themes, and those of social value, sustainability, digitisation and sustainability that I've just mentioned. As the NHS is such a huge consumer of services, we're such a massive employer of people and major contributor to the UK economy, as well as a huge cost for taxpayers. It's difficult, isn't it, to think of many organisations that compare to us for size, complexity and criticality of delivery. So challenging times in procurement, but exciting times ahead too. Thank you very much.
Alison, thanks so much for such an interesting keynote. So many takeaways there, things that really stood out to me. The to-do list is long, collaboration is back in, and think local, act global. And also Alison leaving on us a very positive note about the opportunities that lie ahead. I'd like to take this opportunity to thank you, our audience, for joining us so far. I hope that you're enjoying the discussions we're having and that you're having an enjoyable time. Make sure that you do take advantage of everything that the platform has to offer all the time. Scoring points with our gamification tool. Just a reminder that those in first, second and third places will get an Amazon voucher or the opportunity to donate in their name to their chosen charity. And by jumping into the meeting hub, you're building connections with delegates, not just for this event. You'll have the opportunity to connect with delegates who sign up for future events too. It's lunchtime now, so let's meet back here at 2 o'clock after a well-deserved break and let the information from this morning's discussions soak in. I'll see you at 2.